Hello everyone. So today we are talking about occlusion. This is an overlapping topic. Some concepts of occlusion we have already seen in orthodontics. Some will be dealt in prosthodontics. So this is relatively the questions regarding to occlusion is being discussed along with various other topics. And when we are discussing it from an oral anatomy perspective, it's a very limited chapter or kind of a small chapter because most of the things, basics, concepts regarding to occlusion have already been dealt in orthodontics. So we will have a quick look through the any of the missed out points in this chapter. So to begin, we most of you already know what's an overjet and overbite, but for your information, overjet is the horizontal overlap between the anterior tooth, upper and lower anterior tooth. The horizontal overlap is referred to as overjet, whereas the vertical overlap of the upper and lower anterior tooth is referred to as the overbite. Now, when there is an excessive vertical overlap or when there is an excessive overbite of the anterior teeth, this might result in the tissue impingement, and that is called as impinging overbite. So, impinging overbite is a pathological condition when there is excessive overlap of the lower anterior teeth by the upper anterior teeth, and there is impingement of the upper gingiva by the lower anterior teeth, and that is called as impinging overbite. Now, the pathological condition can result in gingivitis and periodontitis over a long period of time. So we have seen overjet and overbite, which is relatively important from the anterior teeth. Now when you're moving to the occlusion or with respect to the occlusion in the posterior region, it is another terminology which is important is the centric relation. So centric relation is the position of maximum intercuspation of the upper and lower teeth. This definition itself has asked as an MCQ question, so that's why I have put the definition itself here. So the position of maximum intercuspation of upper and lower teeth is referred to as centric relation. So when occlusion was analyzed or when occlusion was studied during the previous periods, the emphasis was given to static occlusion. That is when the tooth will come into contact at a static position. But later the emphasis was shifted to dynamic occlusion. That is the contact between the teeth on the upper and lower arches during various functional movements. So when the tooth of one jaw come into occlusal contact with their antagonist tooth during various mandibular movements, that is during various functional movements, it's not like some one surface or not one tip or one cusp is contacting with an opposing cusp. It's not like that. It was considered like that during the static occlusion period. Now when you are giving emphasis to the dynamic occlusion, the teeth are actually contacting at some surfaces. So curved surface of tooth on one arch is coming into contact with the curved surface of tooth on the lower arch or the opposing arch. So that is the kind of contact which is happening during the functional jaw movements. So in dynamic occlusion, it is not like one cusp is coming into contact with the opposing cusp. It is rather a curved surface of one arch or tooth of one arch is coming into contact with the curved surface of the opposing tooth on the opposing arch. So these curved surfaces can be convex or concave. The example for these curved surfaces are the incisal and occlusal thirds of the tooth. So we can see the picture, there is markings which denotes the curved surface. In the anterior tooth it is the incisal thirds, and in the posterior tooth the curved surfaces are located in the occlusal thirds of the tooth, and these surfaces can be either convex or concave. So either a convex surface of the upper arch is coming into contact with the concave surface of the lower arch, or it can be a convex surface of the upper coming into contact with the convex surface of the lower arch itself. So it can be either way, either a convex with a concave or a convex with a convex itself. But it is always some opposing surfaces on the or opposing curved surfaces of the two arches. So that is the functional form of the teeth at the occlusal and incisal thirds during functional jaw movements. So we have already seen how the curved surfaces of the upper and lower arches are contacting with each other at the incisal and occlusal thirds. Now we will see the facial and lingual relationships of each tooth in one arch to its antagonist in the opposing arch during a centric occlusion. So during a centric occlusion, each tooth of one arch will be in contact with the two antagonists in the opposing arch, except for mandibular central incisors and maxillary third molars. So except for mandibular central incisors and maxillary third molars, all the other tooth will be in contact with two antagonists of the opposing arch. So why mandibular central incisors and maxillary third molars are not having two opposing antagonists? It's because they have only one antagonist in the opposing jaw. If you consider maxillary third molar, it's just coming into contact only with the mandibular third molar. The central incisors are coming just in contact with the upper incisors. So there are no except for mandibular central incisors and maxillary third molars, all the other tooth in one arch is in occlusal relationship with two antagonist tooth in the opposing arch. So now we are going to discuss the occlusal contacts and intercuspal relationships between the upper and lower teeth. So this is extremely important from our exam point of view, because we are going to discuss a few terminologies which they have used to ask repeatedly for various competitive exams. So this is clear-cut factual based questions, and we are going to discuss a few terminologies which are extremely important. So the first term we are discussing is the supporting cusp or functional cusp or holding cusp or stamp cusp. So all these four terms has been used to refer the cusp, that is the supporting, functional, holding and stamp. They are all the same. So in the upper arch, it is the lingual cusp of the posterior teeth, and in the lower arch, it is the buccal cusp of the posterior teeth, which are referred to as the supporting, functional, holding or stamp cusp. So in the upper arch, it is the lingual cusp, and in the lower arch it is the buccal cusp. So these two cusps are coming into contact or are making contact with the opposing teeth during a centric relation. So that is why it is called as a supporting, functional, holding or stamp cusp. Now the areas of occlusal contact that a supporting cusp makes with the opposing teeth in centric occlusion is called as the centric stop. For example, the lingual cusp of the maxillary posterior teeth, that is your supporting cusp, it is making contact with the central fossa of the mandibular molar. So that is the central stop. That is the area on which the supporting cusp is making contact in the opposing arch is called as your centric stop. So we have learned two terminologies. One is your supporting cusp, that is also known as functional, holding or stamp cusp, and the second terminology is the centric stop. Now this is a picture which helps in a better understanding of the supporting cusp and centric stop relationship. So look at the picture. In the upper arch, the picture is showing the centric relationship as well as from a facial aspect as well as from an occlusal aspect. So when you're looking at this picture, on the occlusal aspect, the mesiolingual cusp of the maxillary first molar, from there an arrow is pointed downwards towards the central fossa of the mandibular first molar. So it is showing the supporting cusp in the upper arch and the centric stop in the lower arch. In the similar manner, in the lower arch, you can see another arrow is directed from the distobuccal cusp of the mandibular first molar, and it is directed towards the central fossa of the maxillary first molar. So it is showing the supporting cusp in the lower arch, which is the buccal cusp. Here they are showing the distobuccal cusp, and the centric stop in the upper arch, which is the central fossa of the maxillary first molar. So I hope the picture representation gives you a better idea of supporting cusp or holding cusp or functional cusp and its relation to the centric stop. So if you have a supporting cusp, you have non-supporting cusp as well. So this non-supporting cusp is also called as guiding cusp, and in the upper arch it is the buccal cusp, and in the lower arch it is the lingual cusp. So the buccal cusp of the maxillary posteriors and lingual cusp of the mandibular posteriors constitutes your non-supporting or guiding cusp. And one more important thing is that it is this non-supporting cusp which actually forms the facial occlusal line in the maxillary arch. So when you are drawing your occlusal line in the upper arch, the facial occlusal line is constituted by the non-supporting cusp in the upper arch. So the non-supporting or guiding cusp in the upper arch is the buccal cusp, and in the lower arch it is the lingual cusp. So now we are going to see how each tooth in the upper arch and lower arch make contact with the antagonist teeth of the opposing arch. So the first picture, the marked as 1, is showing the contact between the central incisors of upper and lower arch on the labial aspect. It is actually the labial overlapping of the lower incisors by the upper central incisors, and the term is called as, we have seen the vertical overlap is termed as overbite. Ideally, incisal third of the lower incisors will be covered by the upper incisors. So more than 1/3 or more than 2/3 of the coverage is indicative of a deep bite. Now the picture marked as 2 is showing the contact between upper and lower incisors from a mesial aspect, and we can see that the curved surface of the incisal thirds of upper and lower incisors are coming into contact. Now the third picture is showing the maxillary canine being in contact with the distal aspect of the mandibular canine and mesial aspect of the first premolar. From a facial aspect, we can see that the maxillary canine is coming in contact with the distal aspect of the mandibular canine and mesial aspect of the first premolar. Now the maxillary first premolar is coming into contact with the mandibular first premolar. So maxillary first premolar is making contact with the mesial aspect of the maxillary first premolar is making contact with the distal aspect of the mandibular first premolar. So from a mesial aspect, please look at the picture which is marked as 5. The lingual cusp of the maxillary first premolar is coming into contact with the triangular fossa of the lower first premolar. Similarly, the buccal cusp of the mandibular first premolar is coming into contact partly with the canine and partly with the first premolar. Now when you are coming to the mandibular second premolar, there is a little bit variation. Here the buccal cusp of the mandibular second premolar is coming into contact with the mesial central fossa of the maxillary second premolar. So the cusp relationship of the premolars are like this. The maxillary premolars, both the first and second, are coming into the lingual cusp of the maxillary first and second premolars are coming into contact with the triangular fossa of the opposing second premolars of the lower arch, whereas the buccal cusp of the mandibular first premolar is coming into contact partly with the maxillary canine and partly with the maxillary first premolar. The buccal cusp of the mandibular second premolar is coming into contact with the mesial central fossa of the maxillary second premolar. Now look at the pictures 6, 7 and 8. It is describing the relationship of the upper and lower molars from facial and mesial and distal aspect respectively. So from the facial aspect we can see that the mesiobuccal cusp of the upper first molar is coming into contact with the mesiobuccal groove in the lower first molar, whereas the distobuccal cusp of the upper first molar is making contact with the distobuccal groove of the lower first molar. When viewing from a mesial aspect, we can see that the supporting cusp, that is the mesiolingual cusp, is coming into contact with the centric stop in the lower molar, that is the central fossa. Whereas in the picture when viewing from the distal aspect, which is marked as 8, you can see that the distolingual cusp in the upper arch, upper first molar, is coming into contact with the distal marginal ridge and the triangular fossa on the lower first molar. So that is how the relationship, that is how the first molars of the upper and lower arch are coming into contact from the facial, mesial and distal aspects. Now canine guided movement. This is seen in young individuals with unworn dentition. So when in canine guided movement, when there is lateral movement of the mandible, On the working side, the opposing upper and lower canines will come into contact, and when these canines are coming into contact, there is complete disocclusion of the posterior teeth on the working and the balancing side. So that is the feature of a canine guided movement. That is, when there is a lateral movement of the mandible, on the working side the upper and lower canines will come into contact, and there will be complete disocclusion of the posterior teeth on both working and the balancing sides. The canine guided movement is seen in young individuals, and the canines will be unworn. There will be no wear and tear of the canines. They will be like they have the sharp cusp and they will be intact, and hence there will be a contact of the canines on the lateral on the working side during lateral movement. And when there is this contact, there happens to be the complete disocclusion of the posterior teeth on both working as well as balancing sides. Now, group function. So group function, unlike as we have seen in canine guided occlusion, this is more common in the middle age group. So as the aging progresses, there is some wear and tear for the canines, and the canines will be weak. So in this type of occlusion, when there is a contact, when the canines come into contact during lateral movement of the mandible, on the working side, in addition to the canines, there will be a contact between certain posterior teeth as well. So that is the major difference from the canine guided movement. In group function, it is happening in middle age group when there is a weakening or wear and tear of the canine, and in such cases when there is lateral movement of the mandible, on the working side, in addition to the canines, certain other posterior teeth will come into contact. So that's all about occlusion. This is a very relatively simple chapter. Mostly again, with respect to oral anatomy, most of the chapters we have to prepare for fact-based questions. So same is the case for this chapter as well. But it's relatively very easy and to memorize as well. Compared to eruption and calcification, this is not that tough to memorize, but please go through the pictures, because the chances are quite often or more often for picture based questions from this chapter as well. So prepare well.